Sure, so what we've got in place here is part of our surge testing capacity for South Gloucestershire and Bristol. It's one of 3 sites that we've set up over the weekend. The site is run by the Department of Health and Social Care, and their staff are here and running it for us. We've had great uptake, so really appreciate the efforts of those individuals living in the defined postcodes that we shared yesterday, so the 24 areas across South Gloucestershire and Bristol. We saw yesterday 1,000 people come through and get tests, just over 1,000 on this site, which is brilliant. And overall yesterday across the 3 sites we saw about 2,000 tests being carried out. So the purpose is to help find and detect any other mutations that we've identified in South Gloucestershire and Bristol. So a small number have been identified, mutations of the Kent strain, and what we're doing here is testing asymptomatic people from those defined areas where there are cases and ensuring that we stay on top of the spread of the virus. Really important that we do that. What this is science in action, really. So we're testing a large number of people, and they're having a PCR test, which is the same kind of test that people have if they go for a test if they have symptoms. That's followed up then by some genome sequencing, which allows us to identify whether there are any further cases of that particular mutation that we've seen already in South Gloucestershire and Bristol within the area. So the Secretary of State, as you know, announced a variant of interest on Tuesday last week. And then it wasn't until Friday when actually a national body of experts advised that we should now be considering this as a variant of concern and introduce surge testing. So that was the process that was followed, and when we were informed of that, we immediately initiated all of the work that needed to happen across Bristol and South Gloucestershire to ensure that we had these sites up and running, ready to enable surge testing to happen.